Yeah. And so that's how Lumna kind of came up. Do you want to share maybe a little bit about how Lumna helps with these things?
Definitely. So the way we designed LUMNA is to, if the pain is actually in the periphery, so like a damaged nerve, for example, neuropathy or something, it will directly act as an analgesic. So it will reduce pain locally in that area. But also the way we formulated and designed it means that it's systemically absorbed, and a lot of these constituents cross the blood-brain barrier. So that's it reduces that central sensitization to pain that can happen with chronic pain, where again, those pain pathways are so deeply ingrained in the nervous system that the brain is hypersensitive to all sorts of innocuous inputs, like non-painful things that are perceived as painful. So ideally, we're targeting damaged nerves, and a lot of the constituents that we have in there are intended to regenerate or repair damaged neurons, where the pain signals are coming from, to improve nerve health over time, but also to really reduce that background noise of those pain pathways, or that central sensitization. So it's working kind of in multiple ways to reduce pain, both locally and then also brain processing of pain, because in pain medicine we say no brain, no pain. Your brain has to process the signals. And again, ideally over time, especially with things like neuropathic pain, or if the nerves are involved in the pain at all, which they always are, of course, because that's what causes the signaling, it will help to regenerate the damaged nerves over time. It takes a while because the nerves repair slowly, but giving them these chemical messengers to heal, and then ideally over given period of time, the pain will, if not go away completely, be that baseline level of pain will come down quite dramatically over time.
Yeah, sure. And I know that you share more about specifically how each of the constituents does that on lumna.com. So if you're watching this and you want to know more about that, just head on over to there.